No, I'm not feeling it. Alright guys, so hopefully you watched the last video I posted. It was a little skit I made about losing my job. Although some of you guys commented down below that it's an April Fool's joke, sadly it is not an April Fool's joke. It is reality, and I'm sure I'm one of the statistics right now filing for unemployment with the 6.5 or 6.6 million people that are filing, which is a crazy record. Look at this chart right here. Just tell me if we've seen anything like this in the last century. For the last 7 years, I have been working in a medical profession. I've been averaging about 40 to 70 hours weekly. A lot of hard work, a lot of grinding, a lot of overtime. And sadly enough, thinking I'm in the medical field, during this outbreak where they need medical staff, you see what's going on in the hospitals in China, you see what's going on in the hospitals in Italy, and to think they would ever lay me off, tell me not to come into work with what's going on. Who knew, right? Who knew? Anyway, it was time to file for unemployment. That's the only thing we could do. Just follow the herd of sheep that are doing it. Why wouldn't I do it? So probably over the last 2 weeks, we were directly dealing with COVID patients that are having pneumonia-like symptoms, cough, fever, shortness of breath, and whatnot. And I'm sure we were dealing directly with patients before this whole outbreak happened, before we were officially testing patients and we had those testing kits. So the question is, have I been exposed? Have I exposed others? We don't really know because it's crazy. They're not testing medical staff unless they're showing symptoms. But there are nurses currently out there that are treating patients. They didn't get tested, but once they did, they ended up being positive.
This nurse says she worked for about 7 days at 2 New York City hospitals while infected with the coronavirus. She went undetected because her hospital wasn't testing the staff.
Well, there's some pros and some cons of losing my job and being unemployed. The con is I'm not making any income right now, which is gonna suck and it's gonna hurt the bank account. But the positive is I'm at home, I'm safe, I'm sheltering at home and helping others. And you know what? The county we worked in, the suburb, actually was on the news for having the highest outbreak. Let me see what it says exactly. It is leading the suburban Cook County area in positive cases. So it's a hot spot. And yeah, if I had to work, I'd still work. But if I'm off, hey, I'm glad I'm not in the hot spot, honestly. I'm going to show you guys the live count right now with coronavirus patients that are currently infected and currently deceased. And those numbers, as you can see, are very alarming, and I'm sure these are going to grow exponentially through the month of April. All right, now I am looking currently at the statistics from my hospital right now, and this is an internal thing only, so I can't really share the specific numbers with you guys as far as the positive patients and the negative patients, but I will tell you, out of the patients that our company tested, 20%, a little bit over 20% are now positive for the coronavirus. Originally, the hospitalization number was pretty small, but it's been growing exponentially since then, and there's been patients that have deceased already, so rest in peace. Honestly, working in the hospital during this time, I feel like management and the higher-ups really are not informed on what's going on, and they're not looking out for the tech's best interest, whether it's a nurse, a PCT, any other caregivers, or a doctor. Originally, when this happened, they were telling us not to wear masks, don't scare off the patients, just, you know, it's not as dangerous as it appears to be, and put a smile on your face. But at this point in time, now management is telling everybody they need to wear a mask at all times. So those 2 last weeks when I was working, I tried to wear a mask whenever I can, but every time management came around, had to take it off.
What are you doing? Why are you wearing a mask? You know you're contaminating yourself more by wearing a mask.
Yeah, believe it. And most likely everything you've read online as far as shortages, PPE, there's no protective equipment. We're wearing N95 respirators as long as we can. We get one, and then if it's soiled completely, that's when you qualify for another N95 mask. I've had coworkers steal my N95 mask because they had to do COVID patients, and they didn't have a mask. That's how bad it is. So it is true. In conclusion, if I still had this job, I'd be up there, front line, helping my staff, helping the whole community, trying to help people recover from this virus. Unfortunately, we are doing our part staying home. For the most part, people are doing a great job sheltering at home. We've seen the workload decrease tremendously. That's probably one of the reasons I am laid off. But you know, the emergency room is able to care for those patients that are needing care right now for those symptoms. You know, all the elective procedures have been canceled for a long time, such as surgeries, Botox, and whatnot. Big shout out to all the nurses, all the staff that are essential employees that are currently working in the healthcare field, currently working in grocery stores, providing service, providing food, keeping things afloat. All the UPS drivers, garbage men. Thank you guys, everybody, for doing your part in society. Unfortunately, such high unemployment numbers, such catastrophe and deaths in the economy is going to turn things down south for the economy down the road, and you're going to see a lot of foreclosures. You're going to see people not being able to pay their bills, their cars, their homes. You're going to see a lot more mental health problems, anxiety problems, depression problems, bipolar problems, and it's just part of the rodeo, I guess you can say. I hope everyone's doing good, taking it easy. You know, it's life-changing. Yes, it is. We know that. We all got to get along, and we all got to get through it. I have a great book for you guys that are trying to find yourself, find some hope during this dark time. I'm going to post a picture of it right here. Don't forget to get yourself a book and read the whole thing. I'll see you guys on the next video. Peace. Bully Kid out.
I ain't here for the money, I ain't here for the fame. Though it might be nice to own a jet plane, I'ma do it all for you. Come along and see it's true, but the world is pretty cold. You might need a sweater too. I'ma put a ride on ya. Kid from California, trying to make it in life. In school they never taught ya. Dreams of my own, I've been working